So I think the role of emotions, very often, the key thing that I would say is that people are very often not acknowledging their emotions, not paying attention to what's happened. And also, as we say, there's often been a fair amount of build-up to getting ill emotionally in terms of events and triggers that have gone on. And because we're so focused on trying to keep everything going and juggle all the balls and keep it all okay, we sometimes don't give ourselves time to even process what's been going on. Quite often people will have triggers of losing a loved one or relationship breakup or something happening in their lives that does deeply impact them emotionally, but maybe they're not really giving themselves time and resources to deal with. So those factors tend to mean that part of the process of healing, because health to me is a state not just of the absence of illness, but is really a mental, physical, emotion, and what I'd kind of call spiritual state of balance. Well, you've got to get a level of balance with yourself again emotionally to create health again. So that's part of the process of healing, I think.
I think for a lot of people, though, the idea that kind of just not being in touch with their emotions can be a factor in, this whole kind of disease state that's going on. Maybe it's worth explaining a little bit of some of the kind of physiological ways that the mind and the emotions are impacting the body. The body, effectively trying to get the attention of the person.
In really simple terms, and in fact, there are quite a few books out there now that are actually looking at things like the way in which emotions are expressed through the body, molecules of emotion, that kind of approach. But in pretty simple terms, I guess you can look at your body as being the seat of your emotions, your unconscious mind as being the seat of your emotions as well, that whole space. And in a way, when we don't pay attention, and sometimes it can be a little bit like we sort of cut everything off from the neck down. We don't really pay attention to any of this. We aren't really connected. Your body, your unconscious mind has a prime directive, if you like, to keep you safe and keep you well. And also has a level of wisdom. And maybe that's a new idea to some people, the idea that your body has wisdom. But we're quite used to, in our culture and in our language, thinking of the idea of like gut feeling. We talk about that a lot, or, being heartbroken. We do actually have a sense, I think, in our culture that intrinsically our body does have an intelligence to it, that there is a deeper intelligence than just the mind. And one of the ideas that helped me a lot, I think, in getting well was that actually my body wasn't just trying to piss me off by getting ill. It wasn't just a physiological machine that had gone wrong. And it wasn't just, having a bad mood, but almost this process was trying to tell me something about what was happening in my life at that point and who I was being and how I was being. Now, partly that was physically I wasn't taking care of myself. And the body's going to tell you that, We see that as quite a clear kind of indication, clear message.
I think it's interesting what you say about the body having its own intelligence because, when you really think about it, it's extraordinary how complex the human body is and all the amazing things that it's doing on a moment-by-moment basis. And yet people treat it like it's an ignorant thing, which is just suddenly gone wrong and kind of broken down.
We perceive our bodies to be machines. And, you can blame the last couple of 100 years of science. They've done fantastic things for us in many, many ways. But it has turned into a mechanistic view of the body, which is why the medical system works in this way today. You have immunologists who look at one part of the machine and endocrinologists who look at another part of the machine. And actually, it's a whole system. And we increasingly understand that the mind and the body are the same system as well. The emotions in the body are the same system. You can emotionally experience something and your body, your molecules, your cells experience that too. So it's beginning to look at the system, your whole body, as a very intelligent system. We couldn't create this. We have no idea how quite a lot of the body works in some ways, actually, still, even despite the amount of research that's been done and science that's been done. So it's beginning to respect the body as more than a machine and understand that at the point where we burn out, break down in those ways, that isn't an accident. There have been a whole series of things happening. We talked about the triggers and the facets and the factors that go into that. But also that the intelligence of your body is literally saying, hang on, stop. This is not getting you where you want to go. And I suppose if you look at it, and I've had quite a lot of experience over the last few years, I've been honoured to work with a lot of people who've had ME. Actually, it's a bit of a wake-up call. It's a part of us asking us to pay attention. And what you said earlier, it's a great analogy to imagine it being a little bit like like a phone ringing or a toddler, you know. Both of those things are designed to get louder when you don't listen to them. And your body, if you don't listen to what's emotionally and physically happening on a small scale, will just up the scale.
Yeah.
And most people with ME or CFS, by the time they've burnt out, if you really sit back and look, there were always indications, emotionally and physically, that this was coming.